Hello everyone, I am Julian Morris with the Channel 5 News. In the headlines, a new location earmarked for construction of a health center in Newtown. State College says it's adhering to Ministry of Health protocols, ensuring a safe environment for students as face-to-face instruction resumes. And government assistance through the Housing Loans Board improves access to affordable financing for public servants. The details of the news coming up.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
First up in the news, construction on a new health center for Newtown to commence soon. Andrea Louis has that story.
The old Newtown Health Center, located near the Fatima Catholic Church, had been closed down in 2016 as reports indicated it was rodent infested. In 2017, the Ministry of Health confirmed that the auditorium of the new Newtown Primary School would be used as the health center, but this decision was met with opposition by educators and members of the general public. Speaking to reporters last week, Member of Parliament for the Roseau South constituency, Shakira Lockhart-Hippolyte, revealed that another location had been earmarked for the Newtown Health Center.
I can tell you that we have finalized with the landowner. We have purchased the property. It has been gazetted, I believe, twice. So we're well on the way, and I suspect that by early next week, that works will begin on the health center. This health center will be located at the back of the Fatima Church, in between the Fatima Church and the Charlotte Valley Estate area, opposite Valley Engineering. So it will not be too far from the old health center.
Lockhart-Hippolyte says there are other construction projects on the cards for the community, one of which is an upgraded public convenience.
Newtown is a fishing community. The fishermen go out to sea, they spend their time there selling their fish during the course of the day. And yes, they need a public convenience. This public convenience has been in a deplorable condition for years, and I am keeping to one of my promises that I made. My manifesto, my local manifesto, speaks to the rebuilding of a new public convenience. What we intend to do in this area is to have a platform whereby the fishermen can sell their fish, and we're going to do a much smaller public convenience which will entail 2 bathrooms and shower, male and female. And we have further development plans for that area later down.
Newtown's fishing sector is set to see other developmental projects to boost the industry.
It will be a multi-purpose complex that will be built there with a community center, a new jetty, and even to include the sale of gas and diesel. And because we know that a lot of yachts during the season, the tourist season, a lot of yachts come into Newtown on a daily basis, and we want to be able to accommodate the yachts. We want to be able to generate much needed revenue in the Newtown area.
1,619 students have begun classes at the Dominica State College for the 2020 academic year. This represents an increase of 166 from last year. According to Public Relations and Recruitment Officer Monel Alexis, the institution welcomed the first cohort of students on 21st September and another on the 20th of September.
Dominica State College welcomes 512 students to the institution, bringing the total enrollment number to 1,619. September 28, 2020 marks the first day of school for students under the faculties of General Studies, Arts and Sciences, and Applied Arts and Technology. Continuing education students and those under the Faculty of Health Sciences began on September 21st, 2020. President of the college, Dr. Donald Peters, welcomes all students to a safe environment.
Alexis says several measures have been put in place to ensure a safe learning environment for the students in keeping with Ministry of Health protocols.
To date, the cleaners have been trained by the Environmental Coordinating Unit to sanitize all classrooms and buildings properly. The washing facilities are better equipped to serve students and staff. An antibacterial solution is available for use throughout the campus via dispensers. Students can purchase face masks on campus, class sizes are reduced, and a list of protocols is in circulation to guide students and staff during these unprecedented times. The protocols for reopening of the college include: students must wear their masks in class. Anyone entering an office on campus is required to wear a mask. While on campus, students and staff are to maintain social distancing and are encouraged to wear a mask.
The National Health Commission says it has engaged more than 100 individuals and organizations on the proposed changes to the delivery of healthcare services in Dominica. According to the NCH, 73% of the people consulted said there was need for improvement in the delivery and quality of care at the hospital.
The present situation at the hospital is one whereby you have what we refer to as a triumvirate. You have 3 managers at the hospital: a hospital services coordinator, a medical director, and the matron. Each of these people report to a different person at the ministry. We're saying that cannot work. In fact, it has never worked. And if you're going to improve the quality of healthcare, you need to start there. Interestingly enough, when we hear comments in the public domain about quality improvement, we haven't heard anything about the issues of accountability. And we are saying, as a first step, as a very first step, you need to bring the decision making much closer to where it's happening, and that is at the hospital. So that if a spare part is required to get the theater running again, we should not have to have one person making the request to a higher person at the hospital, and then it goes to the ministry, and the ministry to the Ministry of Finance. The system we are proposing will make it much better to have things like that resolved in very, very quick time, because essentially the idea will be to have decision making much closer to where it actually matters.
Timely interventions by the Roosevelt-Skerrit administration is making much-needed home financing available to public servants who otherwise would not be able to access financing at commercial rates. Chairman of the Government Housing Loans Board says affordable financing made possible through government assistance has made a significant impact in the lives of public servants.
The Government Housing Loans Board depends largely on borrowing from financial institutions, but the Labour Party administration have taken certain initiatives that have really greatly assisted the board in providing services in terms of low interest financing services to public officers, particularly public officers who have been at the lower bracket, income bracket, and more so the government through a 2% facility. There was the first 4% facility where the government granted, that is free money, $7.5 million to the Government Housing Loans Board for on-lending at 4% on the reducing balance. Nothing could beat that, and that was in 2007. Following Hurricane Maria, there was a serious shortfall by insurance companies, because in some cases that the houses, in fact, were not valued correctly by the adjusters. In other cases that the insurance gave some shortfalls in terms of payments that the clients could have received. And we were happy that the initiative again was taken by your administration to ensure that some $1.1 million in the first tranche could be given to assist public officers.
So far, 35 public officers have benefited from assistance under the 2% special loan facility, with 63 securing loans under a 4% loan facility. To date, the Government Housing Loans Board has approved 405 loans. Thomas says prior to 2000, the Government Housing Loans Board was dormant. He says the Labour government has pumped life back into the organization.
I remember the former Minister of Finance at one of our functions, said that the previous administration intended to just give up on the Government Housing Loans Board. But in truth and in fact, with the initiative taken by your administration, we had actually reinvented, the Government Housing Loans Board and have made it a giant, which actually created a domino effect in interest rates in the country. And I remember your statement very well when we met, I think it was at the public training center. That's upstairs, the post office, where you granted the first $7 million. And you said, well, it's a small challenge to the other financial institutions to actually match up. Interest rates at the time, you must bear in mind, in Dominica, prior to 2000, was all up at a maximum height of 15%. And that just was not conducive in any mortgage facility. So this actually started that domino effect.
You are watching Channel 5 News. We'll have more after this.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
And as the month of the elderly comes to an end, the Dominica Council on Aging is lamenting the challenges to effectively carrying out its mandate. Andrea Louis explains.
September is recognized as Month of the Elderly under the theme, The Elderly Surviving the Pandemic. The month culminates ahead of International Day of Older Persons on 1st October. While appreciative of government's acknowledgement of the work they do, President of the Dominica Council on Aging, Ophelia Marie, says there are still difficulties in being an efficient council.
Our difficulty is, well, financial, I have to say that and maybe put it first. And secondly, if we could have more dedication, let's say if we had more field officers, I think we might be able to reach with our messages a little further, because we have senior citizens all about the place, on hills, in valleys. We have some persons who need support in terms of care of themselves and of their surroundings.
The DCOA president is of the view that greater numbers and mobility of field officers would ensure the needs of the vulnerable elderly are met.
There are many complaints, people needing legal support, people needing social, financial, all kinds of support. And we really are only a vehicle through which those things can happen, since our financial base is so small. So we have to continue to be okuwan with who is where and what to tell the persons who are taking care of those older persons so that they know where to go in order to find assistance.
Marie believes collaboration among individuals and stakeholders will help the council reach further in its quest to assist the country's senior citizens.
We also have people calling us and asking very interesting questions, and I'm recognizing that persons who can give some maybe even from their need, are willing to give, and they're making those propositions. So I want to thank people to continue being sensitive to the Council on Aging and to the work that we're trying to do. And if government could treat us nicer still, because they are treating us nicely, we will be able to reach further.
Efforts by government to improve the administration of healthcare in Dominica has led to fears that some people who may not be able to afford care under a new system will be denied. The plan is to restructure the way the hospital is managed to improve the delivery and quality of healthcare services. The National Health Commission, currently in consultation with various stakeholders, says inability to pay for healthcare will not be an issue and no one will be turned away.
In fact, in the legislation, even though some people say there's nothing progressive in there, we are pursuing the PAHO WHO thinking and model, where at section 43I or 1, we have had in the draft embedded that no one must be denied care because you cannot
of the inability to pay.
Of the inability to pay. So there is reference to fees because at present there are people with health insurance who may be able to make a contribution, but there is a exemption policy in place, which is something for the government, for your cabinet, which the board must observe. And it is saying, if you are 60, when we look at the cost, you may decide, since Social Security, a number of things are changing. Do you want to move it from 60 to 62 or so on, or you're under 18, you'll be exempted. And we've gone further to say that you cannot be denied care because you are unable to pay. We will cost the care, and we will say, this is what it costs to do so much. Mr. Prime Minister, you have exempted it, but here is the bill, so you know.
The Treasury will cover the cost of healthcare whenever it is provided free of charge to citizens. Plans to modernize the way the hospital is operated is not new, as other countries in the region have implemented similar measures.
Trinidad has done it, Barbados has done it, Antigua has done it, St. Lucia has done it. If you go to Turks and Caicos, you go to Singapore, worldwide, the trend is to let hospitals be managed by professionals so that you can get the best of care. And from very early we've said, and it was your policy wish, that we take a stand to move it towards international standards. So accreditation, we already started talking to Accreditation Canada, and it's a process we reckon will take about 3 years. And that's why I said earlier, we are only going to achieve success if we tackle. And today, I mean, it's no secret, nobody is accountable for anything at the hospital. Some people may not like us to say that, but this is the truth. We can give several examples, but we have a situation in one of the departments. If so many units of whatever that department deals with leaves the unit to go to the wards, they send out 25, maybe 20 come back. What happened to the other 5?
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
To end the news, a look again at the headlines. A new location earmarked for construction of a long-awaited health center in Newtown. State College adheres to Ministry of Health protocols, ensuring a safe environment for students as face-to-face instruction resumes. And government assistance through the Housing Loans Board improves access, to affordable financing for public servants. You may access the news on our YouTube channel. On behalf of the production team, I am Julian Morris. Thank you for watching. Join us tomorrow.